Yes, they do the recording for the meeting, Mr. Garcia.
Oh, okay.
Our
Gotcha.
meetings are being recorded and played on TV 13.
Oh, okay. I hope they tell us when they're recording.
He will, when you start the meeting, he'll start recording.
Cool.
Thank you, Larry.
All right, Mr. Garcia, if you want to go ahead and get started, you may do so. It's 40403.
Okay. I just wanted to check and see. I noticed that we have 3 plus myself is 4.
Miss
Am I
Barbara
correct?
Jackson just joined as well.
Miss Lawson did?
I did.
Hey, Miss Lawson.
Hey, Happy New Year.
Happy New Year to you, man. And so we're missing, right now, we're missing Mr. King, Mr. Clark, and Dr. Fleer.
Yes.
Okay, I do believe we have a quorum, and should they join us, which I know how these Zoom calls go, they can sometimes at the last minute have that.
Dr. Fleer is joining now.
Who is?
Dr. Fleer is joining now.
Dr. Fleer is joining now, okay. All right. Well, with everybody's permission and approval, we'll go ahead and start. We'll go ahead and start today's meeting of the Winston-Salem Transit Authority, our January 28th board meeting. Welcome, and like Miss Lawson said, Happy New Year to everybody. Good to see everybody. I know it's kind of tough to even say Happy New Year, right? 21. What happened to 2020? We all know what happened to 2020. And we need not talk about that. Better days to come. I will let everybody know that this meeting is being recorded and will be available online, I believe, and on channel 13. Is that correct, Tanik, that you mentioned? Public service channel?
Yes, sir.
Okay. So just to let everybody know. And I do want to read, as I do, since we are having this meeting virtually by Zoom, a standard issue statement. Due to the Safer at Home order issued by the Governor Cooper, members of WISTA are participating virtually. All members will vote by roll call, and a member will be recognized, at which time that set board member will state his or her name. So we, again, unfortunately are meeting, but thankfully are meeting via Zoom, a virtual meeting. So thank you again, everybody, for coming today. If we can, let's go ahead and have a verbal roll call. Who's our secretary today?
We have a standee, a designee, Ms. Robin Kirby. She is going to be standing in for Tika in her absence. So
Okay.
Robin will call the roll at this time.
Okay.
Donna, she has no mic.
Okay, if she's having mic issues, I will call the roll at this time. Chairman Robert Garcia,
Here.
Lynette Allendorf,
Here.
Janet Lawson Jackson,
Present.
Philip Osborne,
Present and accounted for.
Latoya Wright,
Here.
and if I'm not mistaken, I believe that Mr. Jack Fleer, Dr. Fleer. Dr. Flair, can you hear us? Okay. I know that Dr. Flair joined. He may be having some technical difficulties. Maybe he'll be able to, well, he's coming back in.
He did say hello just a minute ago when he got on.
Yes.
Mhm. Okay, well, thank you very much, Ms. Woodson. And as we always do, we always have a safety message to start off with. I always think long and hard about what my safety message can be um, for our meetings. And I know it's here lately, the safety message has been, of course, around COVID. And I cannot reemphasize more. Being in the healthcare world, we're reminded every day of the three basics, you know, the mask wearing, the social distance, and the washing of hands. It's a proven fact. It's not a cure. It's just a proven fact that it will help in the fight against this horrible, horrible pandemic that we're in. Also, too, I'm sure everybody is anxious if you haven't already received your COVID-19 immunization. I know they're setting them up frantically all over town. If you need assistance, certainly there are so many places you can go to. You can certainly go to your primary care physician. There's clinics where there are different levels, and the newspaper has been really, really good about letting people know who's up next. So by all means, and don't forget, if you have gotten your first immunization, you will have to get the second one. They'll schedule you for that. So safety message again around this pandemic. So let's all stay safe. At this time, we open the floor to public comment.
And Mr. Chair, we did not receive any calls or emails that requested participation in the public comment period.
Okay, so at this time, we will not have any public comment. Thank you very much, Ms. Woodson. We'll move right into action items, which today we have only one action item, the approval of the October 29th board minutes. We all received those via email. And at this time, I'd like to just give it 1 or 2 minutes, just so everybody can maybe review that or maybe check their notes if there's any thing that you saw in the board minutes that was maybe incorrect or needed editing. We'll give it just a couple of minutes. Okay. If there's no comment, questions regarding the approval of the October 29th WISTA board minutes, do we have an approval? A motion to approve?
Latanya will motion to approve.
Thank you, Latanya. As noted, Ms. Latanya Wright has made a motion. Do we have a second?
Second. Jack Flair.
Dr. Flair, yes, Dr. Flair. Thank you very much, Dr. Flair. All those in favor of the approval of the October 29th Winston-Salem Transit Authority board minutes, please signify by first as a roll call by saying aye. I will start. Aye, Robert Garcia.
I, Latanya Wright.
Aye, Jack Flair.
I, Jeanette Lawson Jackson.
I believe we got
Philip
every.
Osborne.
Lynette must be on mute.
I, Lynette Allendorf.
There we go. Okay. Thank you. And all those opposed, same sign. We have the approval of the October 29th, 2020 WISTA board minutes. Thank you very much. That has been approved. Now we go into old business. If you saw on your agenda, our board holiday celebration has been postponed.
Yes.
Ms. Woodson's gonna call on that. Needless to say, needless to say why. Ms. Woodson, you want to say a few words about that?
Yes, sir. I just actually wanted to bring to the board's attention that we were definitely sad that we were not able to get together as we normally do on an annual basis, just so that staff and WISTA could show our appreciation to our board of directors in a means by us gathering and fellowshipping, eating together, and of course, during our current pandemic, we're not able to do so. We would definitely want to postpone it into a later date because we are always appreciative of everything that you do for the WISTA staff and the city of Winston-Salem. So that is something that will be forthcoming when, of course, safety first, and would allow us to do so.
Thank you, Ms. Woodson. By all means, I don't think you're going to get an argument there. I think we'll look even more forward to our holiday dinner, even if it might be in July. Right. So
Right.
thank you for that.
Thank you.
Okay. Going into new business, we have a COVID-19 update. Ms. Woodson?
Yes, sir. Staff and I wanted to make sure that the board was brought up to speed on COVID-19. Whenever WISTA experiences a positive case or cases, we have an obligation to notify the public because we service the public. And we wanted to show you all this evening how one of the means of our communication. Our marketing director, Tina Carson Wilkins, is notified when we have a case, and she creates and advertises our media release. So these are just a couple of incidents where we did have positive cases at WISTA. And I do want to apologize on behalf of myself for not communicating this directly to the board when it happened. And I will definitely correct that. Hopefully I won't have to moving forward because we're looking for the day that COVID no longer exists. But at this time, I just wanted to present a couple of examples of the media releases that she creates to post to make sure that anyone that rides, whether it's TransAid or fixed route, or actually comes into the transportation center or has any interaction with WISTA, they're notified of a positive case. So this is just a couple of them. And this one specifically basically lets them know our level of service. If we feel that it's going to be threatened at any given rate, we want to publicize and notify the public so that our riders can prepare themselves if we have to reduce our services due to COVID exposures or positive cases. Are there any questions or concerns with the media releases? Okay, thank you.
Well, Ms. Woodson, thank you for that. And we certainly, as all businesses or things that we are associated with, we certainly were avoiding any contact with COVID. And it almost seems inevitable, especially dealing with the general public and the number of people that we deal with. But in speaking with Ms. Woodson, I will let everybody know that they were on top of this and they took all precautionary measures after the fact and continue to take all the necessary precautions, sanitizing the buses, making sure they're taking temperature checks on staff, etc. So I applaud Ms. Woodson and her staff, everybody on the staff, for adhering to these policy CDC guidelines, etc. So thank you very much. And we certainly hope that this does subside within our agency. And then that goes for our passengers too. So thank you very much for bringing us up to speed on that, Ms. Woodson.
Thank you.
Okay, next on the new business is the CARES Act excuse me, I can't read. Expenditures.
Yes. So good evening again. I wanted to present to the board and just bring you up to speed as it relates to our expenditures for the CARES Act 2020 that FTA released and made us aware of in early March of 2020. To date, this is an estimate because we're daily having expenditures towards the CARES Act, but this is just a rundown of some of the things, the items, equipment and services that the CARES Act has supported for us. Of course, with personal protective equipment. That is inclusive of masks. That's also with the sanitizing solutions, gloves, any and everything that we need, our staff needs, as well as the public, because we are still currently providing masks to passengers as needed, since it is a requirement that you have masks on when you enter into a WISTA facility, as well as riding our buses. So we're constantly distributing PPE to our current employees as well as the public as needed. And then we have the temporary cleaners. Those are the people that we have temporarily hired to continue to sanitize the buses as they come in and out the transportation center, and then and to help maintenance in the evenings when the buses come on the yard, with sanitation and sanitizing the buses to keep them, and the vans to keep them safe. So that's that. And then, of course, all of the marketing that Tina does so well, we have to utilize CARES Act funds for that. That's with all of the media exposure for the positive cases, anything related, excuse me, to COVID advertising. We have radio, television, print material, etc. A big hit was the loss in revenues. So of course we were fare free from March until January 3rd. January 4th, 2021, we returned to collecting fares. So for that time period, there was a loss of revenues on the vehicles and the pass sales as well. So we utilized CARES Act funding to offset that loss. The payroll, COVID, sick pay, and the bonus, those are expenditures that are related to COVID cases, positive cases, exposures where employees have to be out in quarantine. The bonus, the incentive pay for employees, because they are essential and we want to keep them working and show that appreciation. We were able to utilize some operating funds towards operating costs as it relates to our buses that have been ordered. And so we were able to get 8 of those that this board approved. Supplies is operational supplies, the Guarantee Ride program, where we utilized taxi service to provide service to individuals that were affected when we had a reduction in our service hours. Then of course we have the Union Station upfit. And so total to date, we've roughly over $9 million with a balance forward of a little over 3 million, because we had a total of 12,389,000 total that was allocated towards us. And just briefly at the bottom, you'll see where we continue to work towards those individual categories that we would apply funds for, the balance of the CARES Act funds towards PPE, temporary cleaning staff, lost revenues through the 4th, any operational expenses, and marketing and payroll relative to COVID. So I just wanted to give the board a brief overview of where we are, where we were, and where we're going as it relates to the expenditures, the CARES Act expenditures. Also, I will add that I'm sure that you all were made aware that there was a second round of CARES Act, and Winston-Salem, the city of Winston-Salem and Worcester did not qualify to receive those funds based off of the formula that was used, because we actually met with the formula they used. We had at least 75% of what we were allocated for. So you'll see where some surrounding cities were able to obtain those funds, but the city of Winston-Salem and Worcester were not. So I just wanted to make sure that you are aware of that. They are transit. The transit officials in North Carolina DOT are going back to the federal government to request a 3rd round of CARES Act in hopes that we all could receive funds, because we don't know how long we're going to be affected with COVID, but we do know that we'll need funds to offset all of these categories and then some. So hopefully we'll be able to receive additional funding moving forward. Are there any questions or concerns about the CARES Act expenditures? Okay, thank you, Chairman.
Okay. Certainly, it's pretty evident by these figures, just what this pandemic has cost. And thank you. And you say we are seeking, in the event that this continues, which good possibility for how long into the 2021, but we are seeking more funds. Correct, Ms.
Yes. And just a side note, where staff is working, so I don't have a lot to report on it at this time. But with the vaccine sites, WISTA has been named the responsible transit authority to provide or assist in providing transportation to and from the vaccine sites. So we're looking to secure additional funding to offset those costs as well, because of course there those will be fare free as well, to make sure that the citizens of Winston-Salem have no barriers against getting to and from the vaccine locations. So we'll be utilizing some of the CARES Act funds and other funding sources for that expenditure as well.
And thank you for that. That was in my day job in the healthcare world. That was brought up in our weekly meeting. And I was so proud to hear that, that it spoke of, our president CEO spoke of WISTA providing that transportation for that. So yes, very much appreciated. Thank you.
Thank you.
Okay, now we're going to talk about a press release and marketing in regards to the fare collection reinstatement.
Okay, I think that, I believe I missed that one. I'll be honest with you.
That's
I'm not
okay.
sure I missed that one, but yes, that was just the update that I gave, spoke on with the media exposure that Tina provides to make sure everybody's aware. She created a media release to advise passengers of the fares being started, the fares back on January the 4th. She also worked with Greensboro GTA. They actually created a commercial that advertised the fare collection collaboration between Greensboro, High Point, and Winston-Salem, so that we can make sure that all the passengers were well aware and more than 30 days in advance of January the 4th. So the information was put out there on the commercial, on TV, on radio, social media, our website, the city's website. So everyone was aware that January 4th was coming and we were collecting fares again on that day. And I apologize for that not being in my minutes. I'm not sure how that was omitted.
Okay. Okay. Now moving forward, Carol, I believe you have a presentation for us, an operation report, data presentation.
I do. Good afternoon, everyone.
Okay.
I am coming to you from my home today as we are practicing social distancing at work. Donna is going to be handling the controls. But just to start off, I just want to say that this is kind of like a calendar year review since we're going through December. So I'm going to approach the presentation that way. Next slide, please.
Let me put this in.
As we know, this year has been a most unusual year, and it certainly reflects that in the data. You know, first looking at the fixed route data on the left side of the screen, you can see that, you know, in April, we were down close to 50%, but we have made our way back in December to being down only 15%. So we rebounded pretty nicely on fixed route. Now, also keep in mind, there were a lot of service changes going on during that time, because in March, we still had the mitigation routes going on. We went fare free, you know, for most of the year, starting in April. And then also we had Saturday service for a good portion of the year. But that's, you know, given all that, we still rebounded nicely on the ridership. Looking at Transat on the right side of the screen, not surprisingly, much bigger impact there, but it has slowly been coming back too. And at the end of December, we were down about 27% from what we normally would be that time of the year. Next slide, please. Now, this is the slide that I get from PART each month, where they're doing a comparison of all the transit agencies in the region. And If you look all the way on the right at the December portion, we are the light blue on the left side of that cluster of bars, downward bars. And so we are doing very well compared to our sister agencies. Now, High Point, which is the other blue one that's even doing better than us, they actually added service over the course of the year, which is why their impact looks so much better. But compared to the other agencies, High Point, Link, which is Burlington, Greensboro, we have rebounded in ridership much quicker. Next slide, please. Now switching over to just looking at fixed route service, you can see how much it changed over the course of the year, where we started in the 200,000s in the early part of 2020 and ended at about 170,000. And you know, like I said, it's been going up and down, but thankfully generally in an upward trend. And hopefully that will continue, although we do know there's going to be an impact since we went back to fare paying, but I'll save that till next month. Next slide, please. Okay, looking at the passengers per revenue mile, tremendous impact on this too. And you can tell that once about October, we went back to, well, actually the end of September, but October, we went back to full service. So you can see that towards the end of the year, the revenue hours, passengers per revenue hours started going down again because we were offering more service. And so it's kind of dropped. But we are up at almost 14, which was great. And now we're down as of December, about 12.5, which is not a big deal, thinking, you know, 12 to 13. So we've been hanging in there nicely. Next slide, please. Looking at wheelchair passengers, it almost looks like we're, you know, hanging in there, but you have to consider that we're comparing this 13-month comparison is comparing December to December, and usually our highest wheelchair months are in the summer. So actually this is much lower than we usually would see. Even though, you know, it looks like we're hanging steady, but we're actually doing, I've got some notes written down here. We're down about 19% on wheelchair passengers from where we would normally be. Next slide, please. And on bicycle passengers, it looks like we're increasing, but again, this is because we're comparing, you know, a lot of winter months. So if we're actually down on bike riders, I think about 10%, 15%. You know, in the summer months, we were way down, obviously, because, you know, that's when the lockdown was in place. But we are rebounding nicely. And I guess, you know, people are out riding their bikes because they have more time, maybe. Next slide, please. On-time performance has been holding steady through all the different changes in service. And next slide. Transitioning over to TransAid ridership. The past year, again, it dipped and then it came back up a little bit, and we ended the end of the year a little over 13,000 passenger trips. And hopefully that will continue, you know, to head up. We're, you know, down about 27% from where we were last year. Next slide, please. And then TransAid passengers per revenue hour, we're at 2.5, which is actually still really, really good. We were at 3, but 2.5, we're doing very well, very healthy. The average, I think, in the industry is around 2. Next slide, please. Obviously, wheelchair ridership has taken a hit during COVID. But, you know, at the end of December, we were at almost 1,900, and we're still down about 15% from what we would normally be at. Next slide, please. Now, here's a good story to tell. On-time performance for TransAid. They have been just making a lot of improvements on how we run the service. And as you can see in the slide, It really has gone up. And I really thought that once service started increasing again, maybe the on-time performance would go down. But no, it's just continued to go up. So they have done a really good job in TransAid to deal with issues as they find them and find ways to make the service run much smoother. And at 99, 98%, that's amazing. Next slide. Now switching gears and looking at accidents. Again, this is a good story to tell. I don't know if you remember our past charts, but they were a lot of the accidents were in double digits. And this past year, we had no months in double digits because this is looking at total accidents, all the services included, and it looks so much better. We've had no preventable accidents 3 months out of the year last year, March, August, and October. And actually in March, we had no accidents, period. So that is a tremendous improvement from where we've been in the past. Next slide, please. Looking at fixed route accidents over the past year, again, a very nice picture here. We've had a number of months with 3 months with no accidents at all, and 6 months with no preventable accidents. So again, they're doing very, very well. Next slide, please. And on TransAid, even better. Lots of months there, 5 months where we had no accidents whatsoever. And for the whole, the last 13 months, we've only had 3 preventable accidents. So that is a tremendous job. And then next slide, maintenance, doing great. Only had 1 accident the whole last year. So tremendous,
Wow.
tremendous improvement. Next slide. Looking also into maintenance at the road calls that they've done over the past year. We do a good bit of road calls, and it just kind of goes up and down each month. And I think weather may, the seasons may have an impact on the up and downs. As we get into the cold months, it tends to go up a little bit, and in the very hot months, it goes up a little bit. But and just the obviously fixed route has more than TransAid because it's a bigger service. But we average about 37 a month, roughly. Next slide, please. Looking at the fixed route road calls over the last year by the 2 different types of failures, the major mechanical failures, which is something that just takes the bus out of service. And the other mechanical failures are something that's minor that maybe you can make it back to the depot and be fixed, or the transit center and be fixed there. So looking at fixed route over the past year, had a lot of major mechanical failures, but we got some old buses that I know John's working very hard to keep on the road. And I think they averaged about 30 road calls a month for fixed route. Next slide, please. And on TransAid, not quite as many. They average about 8 road calls a month. And they're about, I think about half of that is major road calls. Whereas on fixed route, I think it was up about 60% were major. Next slide, please. Okay, looking at the incoming phone calls into our call center over the last few years, that bottom line, the yellow line, is 2020. And you can see with COVID, obviously, it took a dip. It went down significantly. We're down about 31% on the amount of phone calls coming in for, at the end of the year. Next slide, please. But the good news is that the percentage of phone calls being answered is just, way up there, 97, 98% for most of the year. And actually they have gone, I think 15 months meeting the goal that we have of 95% every month for the last 15 months. So that's tremendous. Congratulations to them. And next slide, please. And this is just looking at the abandoned calls, which you can imagine have gone down as we are doing a better job of answering the calls. And we average about 700 a month now, where in the past we were, much, much higher. Next, I believe that's the last slide. Any questions?
Well, Carol, well, I don't have a question, but I've got to applaud everybody. The on-time performance was phenomenal.
Mm-hmm. Yes, it
Yeah,
was.
great numbers there. Same way with the accidents and
Mm-hmm.
out on the buses, but in the maintenance department, kudos to John and his team. So kudos to everybody, the training and everything. It all comes to fruition, doesn't it, Miss Woodson?
Yes, sir, it does. It does. Staff works really hard. I couldn't ask for a better staff and operators.
Fellow board members, any comments, questions?
Lots of positives. So I agree. It's just fantastic that, we see so much improvement in so many different areas.
Thank
Absolutely.
you.
This is Lynette. I would agree. Just a quick question. I'm just curious. I realize this piggybacks off of what Ms. Woodson was saying earlier about the funding. With the decline in ridership and whatnot, have we been able to keep everyone full-time employed that in what they were before the drop in the numbers?
Yes, ma'am. And I'm actually pleased to say, and this has been reported on other meetings that I've attended, the city of Winston-Salem really did a really good job with wanting to keep all of the employees at WISTA and other city facilities, city departments, at work or being paid. So no WISTA employee was laid off due to COVID. Everybody was, kept working at their current status. We found ways to keep when everything was in April and May. We had operators doing additional duties and stuff such as cleaning and different things like that to keep everybody at full pay.
Fantastic. Very good. Thank you.
Any further questions or comments? Okay. If not, I think we're going to go to the staff reports and also to the financials. Ms. Woodson?
So these are just the, hopefully everyone had an opportunity to go through the financial reports and the funding sources, all of the staff reports that we provide on a monthly basis. What we did in this one, because our last meeting was on in October. So what you received in your agenda package was the October monthlies, the November monthly, as well as the December monthlies. So I won't go into depth about each one, but I will entertain any questions or comments on any of the staff reports that we have. So briefly, and the reason why is because most of all this data that's here was presented and discussed during Carol's presentation because it's a monthly basis. So this is just basically the same information in a separate format. Okay.
Okay. Which Carol, like you said, Carol summed up there.
Yes.
Right.
And Carol's presentation is very helpful. It's so much more visual and easy to understand. And thank her for her continued work.
Yes. Yes.
Couldn't agree with you.
Her passion for data. It's beneficial to WISTA, definitely. Next, we have our financial reports. And basically, we know that with the CARES Act funding, it offsets some of our losses. So at different times of the year, we, were favorable in our reporting. And we took a kind of a hit in November because of some additional losses, about $45,000 worth. But we are still, utilizing CARES Act funds to offset those expenditures. So these are our revenues for October and our expenses for October, November, and December. So you can see where we come in favorable.
I didn't quite understand. Ms. Woodson, what did you say we might have lost?
We had experienced some losses because of the additional revenues and some other net losses that were approximately came up to about $45,000.
That was after the CARES Act?
Yes.
Thank you very much.
Ms. Wilson, when we, and maybe in talking with your peers out in other communities and so forth, what's the average, or how's it looking out there for some of our peers in other communities as far as public transportation through this pandemic year?
Most of the other our sister and transit authorities are experiencing some of the same. WISTA actually is more favorable than some other agencies. Of course, the obvious with GTA, with the second round of CARES Act funding, they were able to receive $5 million for that second round because they did not receive as much funding as WISTA did prior to. So the federal government they made them whole up to that $75,000 $75,000 threshold. So that's why they were able to obtain that second rounds of CARES Act. So, and I know that their ridership, as you saw on the presentation from PART, they lost a lot more ridership. They had times when they had to shut down completely, versus with WISTA, we've been able to maintain and keep our operations going, which we find that to be, a blessing. I guess should say that, but yes, we find that to be something that anytime we can continue services, when we have as much interaction with the public as we do, I think that's awesome, because we didn't have a lot. And as you can see with our ridership, we did take a hit specifically in April, but we regained our ridership to a certain level that we feel comfortable with this time, because we are still having a low capacity maximum on our buses of 25 on the fixed route and 12 on the TransAid. So that creates a challenge as well, but we're able to meet that and still maintain a decent on-time performance. So I think that overall, when we compare ourselves to our neighboring transit authorities, we're doing really fairly good.
So would that mean that if you take into account the requirements about lower capacity, and as I was just reviewing, we say that ridership is down about 15% for fixed route, yes, and 20%. And that's considering that you actually have a lower capacity.
Yes, sir.
That's amazing.
Yes, sir. And one of the things that with TransAid, they have, created some operating procedures that help them with their on-time performance. But if you take into account the reduction in passenger ridership and looking at the on-time performance, it kind of lets you know where we need to be as far as vehicle and operator ratio to our current level of ridership. So as the ridership increases, it's very, very likely that our on-time performance will go down some as the ridership goes back up, because it'll take more time for trips to travel to and from, loading factors. So we have to take that in consideration too. So while we're extremely happy about the high on-time performance, there's a lot of reason behind it. So we get back to where right now we're averaging about 700-800 trips. If we get back to around 600 or 700 trips a day, if we get back to 1,300, 1,200, 1,000, then you start having barriers and challenges when it comes to on-time performance and a productive service efficiency.
Right.
And usually that's That's always been the biggest complaint, hasn't it?
Yes, ma'am. Yes.
Related to the really phenomenal job that the staff has done, what is the minimum wage now?
The drivers, I'm not sure what the minimum wage for, you saying for the all over or for Worcester?
For Worcester?
Worcester is 1378, I believe, 1552 for fixed route.
Do we have a goal of getting it to 15?
We have, that's done with our negotiations in the union, and it's actually coming up. And this contract will end June 30th, 2020. So when the salaries are negotiated with the union. So of course, we do see a need to increase salaries. So we'll have to negotiate that in compliance with the city budget, in line with that.
You mean June 21, right?
21, did I say 2020?
It's
Thank
all
you.
right.
I don't want to go back to 2020.
No.
That's for sure. June.
So
21.
how does that relate to the city? I know the city has been attempting to move up to a minimum of 15, but I'm not certain whether it's there yet.
It is not there. I don't know how that's going to pan out in the near future, but I can definitely inquire about that and report on that because that's an interesting fact, because that would, have an impact on what we do in our negotiations and what we bring to the table.
Do you have any idea what percentage of our employee workforce is at the minimum wage?
I don't have a percentage, but I can get that for you.
Thank you. I think it's very important. I'm not certain even how minimum wage is sufficient for people to live, but
Right.
it's at least a guideline.
That's true. So true.
Thank you.
Yes,
Thank you.
Dr. Flair.
Okay.
Well, if there's no more, if there's no further comments or questions, we always come to one of our favorite parts here where Miss Tina Carson Wilkins talks about marketing.
Yes. Tina?
Can you hear me?
Yes, we can
Okay,
now.
great, great. Okay, well, thank you so much, Mr. Garcia. I just wanted to share in the information that I sent to you, the ridership data for November and December, but as Donna stated, Carol did a bang up job with presenting that information for you. It's just for you to get a bird's eye view of how things were, particularly with the mitigation routes, the effect of the loss of that. But nonetheless, that the statistics pretty much came from Carol anyway. So, but we can go on to the next. We worked with GTA and High Point Transit Systems to present information to all of our riders simultaneously, because it just so happened that we were all going to be ending our fare-free service on January 4th. So Kevin Elwood with GTA approached me about it, and Donna gave us a thumbs up to participate. So they had some trade left with Fox 8, and we decided to take on the responsibility of the ads on with Intercom Communications. And so we wanted to let everyone know at the same time that the fare-free service would be ending. We did create a commercial. We all put our information together. I don't know if Donna will be able to play that commercial. I sent it, but nonetheless, I happened to be, I don't know, I was in the drugstore and one of the passengers happened to be there as well and said to me that they got the information about the fair starting up again. So I gave them a thumbs up because it let me know that all of the work that we put into it was working. We put that information in the Chronicle. We put it all over our social media. And so riders were very receptive. And the one thing that really surprised me more and pleasantly surprised me when I pulled up our Facebook page just to see how our ridership was responding, because we also did some geofencing on that, which is putting the information out to people all over the city. I was originally going to just do geofencing here at the transportation center, but our buses go everywhere. And so I wanted to get the message out all over the place. Every single message was just saying, thank you, Wista, for what you did for us. That warmed my heart because it helped me understand that our ridership got it. They knew that it was a sacrifice on our behalf, and they were so grateful that Worcester was fare free from April 15th up until January 4th. So the thank yous were abundant, and I was really grateful that everybody was saying some great things to us about that. And then I also wanted to let you know in the report that I sent, we can come down a little bit, Donna, is that when 2020 ended, the Winston-Salem Transit Authority had absolutely no near misses for pedestrian or cyclist strikes, which was great. It meant that our pedestrian and cyclist campaign was a great success. Back in September, our safety managers got together and wanted to come up with different ways to focus on helping our employees stay alert as to the fact that pedestrians and cyclists share the road with us every single day. So our vehicles are out there, yes, but there are also people who are walking where they want to walk or riding their bikes where they want to go. So we put our heads together and came up with some things. So one, it was sort of like the Where is Waldo, but it was Where is the Pedestrian, with a cutout that operators were supposed to look for. Then of course, campaign on Your Mom is in the crosswalk to try to make sure that our operators were very aware of who might be walking across the street. And then we decided to have a solidarity campaign where we signed employees up to say that, yes, I am making a pact with our safety managers. We're going to pay close attention to what we're doing because we don't want to have any pedestrian or cyclist strikes. And we kind of threw a little bit of an incentive in there by saying at the end of the year, if there were no strikes or near misses, then anyone who drove safely during that particular time would have their name added into for a drawing to win some really great Worcester prizes. The grand prize was about $500 worth of Worcester items. Second prize was $400. Third prize was $300. And so we played it up and helped our employees understand all of the great things they were going to get. So we got Vanna Tequila to take a picture to just show everybody exactly what it was that the drawing was going to entail. And so our number one, our top winner was Transaid operator Miss Karen Conyers, who had actually only been with us a very short time. So she was so excited because she did not have a lot of Worcester loot. And so with that, she got, I think, a sterilizing box, backpack, lunch cooler, lawn chair, umbrella, ice scraper, flashlight. I mean, she got the gamut, everything. She even got a bomber jacket to put on. And so all of the items that the other employees got, they got similar things, but just fewer than what Ms. Conyers got. Our second prize winner was Mr. Willie Hauser, who's been with us about 15 years. And Mr. Hauser is a great operator, and he gets safety awards all the time. And so some of the items that he got were just a surprise to him because he had not gotten some of those in the past either. And then our third prize winner was a young lady by the name of Caroline Cruz. So those items, believe it or not, because I save everything. So some of those items have been in my office for like 2-3 years, but they don't have to know that. But when they got them, it was just like brand new. It was Christmas for them. So, but it was a combination of items that we had gotten from past safety awards where some people didn't pick up their items, so we had to meet certain requirements in terms of minimums. So they were put away for a rainy day. And so that rainy day happened for them on December 31st. So they really loved it. And we're looking forward to doing other things like that. But it was really great. And Worcester really did come out on top. We did shine because there were not even near misses with this particular contest. Of course, we did the bingo contest, but it was different, a way to just keep them interested. But the PAC Solidarity campaign was a hit. So it went very, very well. I'd also like to—
Great success story. Thank you.
It was great. It really was. I want to share with you that we're going to have a second bus shelter artwork project. The dates haven't been really set yet, but as you know, if you've traveled around town, you have seen some of the artwork and some of the shelters. We've really gotten rave reviews from the public on that. So much so that there's going to be a second artwork project. And so some of us will be putting that information together, and we'll be putting it out to the public, because it was about, I think, almost a year ago that
Right.
we started the first project. So I will keep you all informed on how that is going. And but we're looking forward to doing additional shelters throughout the city of Winston-Salem. If you have any questions, I'll be happy to answer them.
Well, Tina, I have to reiterate what Dr. Flair just said. Fantastic reporting, and it's always great to see that people are participating in these promotions and projects that you have going on internally, and they take it seriously, and they have a sense of pride. I think that's what it's all about. I know y'all work very hard to commend and to reward these great staff members that we have. So thank you very much for all your efforts.
Well,
So is your office clean now?
not a chance. No, I still have I'll move out of the way. I don't know if you can see all those boxes over there. So no, I
Yes.
still have plenty of things that we're going to be doing for other promotions for the employees.
Well, we know where the stash is.
Exactly.
Well, this has been a great meeting. Before I close, any further comments or questions from the board?
I just hope that I'm registered as having gotten there late.
You will. We will make sure you're on the
You're covered, Dr. Flair.
Dr. Flair.
Ms. Woodson, I just had one question when I was thinking about this, and not to pour a little salt on any of this at all, but are we thinking, or are you thinking and the crew thinking about the what ifs going into 2021? I know for a lot of businesses are thinking about the what ifs when things are going to get better here in the next couple of months. Are we thinking along those lines, or are we taking precautionary measures, or thinking about bringing back some routes or tightening up things in the event that it goes beyond the first, second, or third quarter?
To be honest, yes, we have in our weekly staff meetings and some of the meetings that I attend with the city, we are taking an approach as if we don't know the outcome or the end.
Okay.
So when we're planning any type of festivities, the festival, contract, everything we're doing, we're planning it for both sides. So we're planning in case we're able to have in-person events, and we also are having a backup for virtual, knowing that virtual may be what we are going to in the first quarter of this year, and hoping that it'll get better as the year progresses. So we're just looking at both sides of it so that we can still engage our employees and the citizens in different activities, but from, with creative ideas and creative ways.
Great. Well, everyone, I want to thank all of our board members, all of the WISTA staff members, Also 2 representatives from the city that are in attendance. Thank you for joining us. Despite the fact that we have to look at each other, these little bitty squares, it's so great to see your faces and that you're keeping the flag waving there for Wista, and you're making things happening. So despite the fact that there has been some COVID issues, et cetera, and we're just hoping and praying that it gets better. And I can't commend Ms. Woodson and the team more. Just phenomenal jobs. Keep it up, and thanks everybody for your support. So
Thank you.
until the next meeting, I hope you have a great rest of your week, and maybe we'll get a snowstorm, right?
No,
Let's hope so.
We missed it.
we have to keep those wheels turning.
Okay, no snow for Miss Woodson or Tina. Okay,
They got more in Raleigh than we did.
there you go. And to think, we bought all that milk and bread for nothing, right? Right. All right, everyone. Thank you very much. Have a great rest of your day and the rest of your week.
Thank
Thank you.
you.
Thanks, bye.
Bye-bye.
Goodbye.